There are two main objectives for the training division of the Fairfax County Fire and Rescue Department. The first is to train new employees, and the second is to provide continuing education.
Because emergency medical responses make up a majority of the calls that we run, we are in a continuous training cycle to keep our responders on top of their skills.
The medical skills our personnel need range from treating simple falls to resuscitating cardiac arrests to addressing mass casualty incidents.
EMTB and ALS are the two levels of emergency medical skills we teach.
Well, the EMTB is basically an EMT basic provider, and they go through roughly a 5 to 6 week initial certification course where they learn the basic techniques of airway management, first aid training such as how to stop bleeding, how to stabilize injured spine and head injury patients. So that it's more of a basic skill what you can do. With the advanced ALS provider, advanced life support, they go through a much more vigorous training. Usually it's from EMTB, then you go into the ALS. And that encompasses learning more about anatomy and physiology, learning about pharmacology, and what certain drugs that we use. And it goes into a lot of the critical thinking about as people give you signs and symptoms, you're able to diagnose or find out what's going on with them, then give them the appropriate treatment. One of the goals of the department is to ensure that there's an ALS provider on every medical emergency within 4 to 6 minutes. And one way to achieve that is to increase the amount of ALS providers we have and place them on engine companies, ladder companies, and rescue squads. We knew we had to increase our educational opportunities for our ALS providers, but also for our EMTB providers. So we decided, let's take the classroom to the field.
A grant from the Commonwealth of Virginia allowed the department to implement a medical training vehicle, or mobile training lab, to effectively deliver continuous medical education to each fire station.
We'll leave the academy, go to our stations that we're assigned to for that day, and set up on their grounds. Get the PowerPoints ready, get the equipment out, and be ready to bring in our students. The mobile training lab definitely affords the great opportunity to go out and see our field providers at the station level again and be out in the field. The mobile training lab is staffed each day when it goes out with one uniformed lieutenant from the EMS training division, as well as one of our civilian employees who is a certified physician's assistant.
My role as clinical practitioner here with Fairfax County Fire and Rescue Training Facility is to basically turn technicians into clinicians. It allows us to train in very small classes, which allows for one-on-one instructor interaction. It also enhances the ability to learn in those small class sizes. So with all of the skills that they learn, 12 lead recognition, as well as stroke, signs of strokes, and what to do with stroke patients, what facility to take them to. They have to recognize all these things, and that's what we hope our training with the mobile training lab and other resources is able to do.
It keeps units, which would be out of service, in service. It keeps us more productive here at the station. We spend less time traveling and more time actually doing our skills and improving our skills. It builds teamwork. It keeps the master calendar free all the way around. It's a benefit to have the training come to you rather than you try to go get the training.
Usually in a day we can get maybe 6 sessions in, which is more than we would have the opportunity by bringing them up to the academy and placing them out of service. So it's in-service training, and we're increasing our objective of getting them more continuous education.
The training agenda incorporates teaching BLS and ALS providers in the same session. This capitalizes on developing critical peer education, mentoring, and leadership skills within our workforce.
Well, during an emergency response, we always emphasize teamwork. Teamwork basically satisfies a lot of components of learning in that if you are incorrect about a situation and you work as a team, someone can correct you. Also, 2 heads are always better than 1, so once you bounce ideas off of a team member, it makes it better for that patient and increases the patient's satisfaction as well as patient's compliance. And what that means is that patients do much better in days to come.
The physician's assistant and I will start with our lecture portion of the day, We'll bring up a PowerPoint presentation and discuss the topics and the objectives that we'd like to meet with the training for this session. After we complete that portion, we'll move into the hands-on practical setting in the back of the mobile training lab.
We always do an adult cardiac course, we do a trauma course, and then we also do a pediatric course. And then every other year we also do continuing education credits.
One of the things we have in the training lab is a human patient simulator. And what that enables us to do is to program that mannequin to give certain signs and symptoms so that when they're assessing that mannequin, they can start determining what may be wrong with it. We can put it into cardiac arrest, we can make it sweat, we can make it do many different things.
Most of our providers are tested using the SimMan device. We have the third generation device that is wireless, and we put them in a testing scenario, testing room or testing environment, and all of them are tested with the same standards, our highest level, our highest standard level, and basically that keeps it constant across each provider.
ALS and BLS training together definitely helps with the interactivity of working together on calls. That's how we operate in the field. So in theory, we should train that way. We practice how you play. It helps them work more smoothly, calls run better, and skills are performed more effectively. The level of interaction between the instructors and the students is fairly extensive. We do have a lot of questions we receive from the students and give a lot of feedback, and it's nice because of the small group that's in the mobile training lab at the time. We have that ability that we can expand on different ideas and different questions.
It causes continuity with your team, everyone working in concert, and this is going to reflect really positively when it's the real call, the citizen's life is in danger and the citizen needs to be saved. And if we train together as a shift, and if we have that continuity and that teamwork, then we're going to win on the call.
When our students train with SimMan, they treat him as they would an actual patient in the field. And that mannequin has the ability to give immediate feedback as a person would actually react in that situation. The wireless aspect of SimMan allows us to be removed completely from the scene. That allows the EMS providers to run this as they would any other call on any day at the station. Instead of continually asking the instructor for feedback, they have to receive it directly from SimMan, their patient.
He can have a pulse, he can blink his eyes, he's able to sweat, he's able to drool. And those types of things give them clinical clues, so it takes us out of the training environment. So we can go behind a wall, we can go behind glass, and we can basically watch how they interact with that particular patient. It challenges them to use their skills in a very complex situation.
Vitals are provided in real time. He breathes in real time. He has heart troubles in real time. And all of this is relayed to us as if this was a real patient. Other than the guy having a plastic face, it's completely realistic to what you would see in the field. It takes our training to the next level.
The implementation of the mobile training lab is part of a training approach to develop medical skills for all our personnel and help develop our vision of lifelong learning across the department and throughout the span of an individual's career.
The advanced training that's received on the mobile training lab definitely improves the service that is provided to the patients in the field.
And they get the best possible product we can possibly deliver.